Hi everybody, it's Joel Wood, your lobbyist here in Washington. Hope you're doing well. Counting down the days already to the August congressional recess. This week, the BI Top 100 Brokers issue came out, always anxiously awaited to see sort of who's in, who's out, who's moving up, who's moving down, who's new to the list. And it's always gratifying to see a list that is so chock full of council member firms, so few in that top 100 who are not active participants with our association. It's really reassuring that we are the leading organization when you look at that. One other article that I noticed in the BI coverage, though, was one regarding surplus lines and the national non-admitted insurance clearinghouse that Florida is attempting to run with virtually no participation, only 4 small states and Florida that are a part of it, and incredible quotes from the organizers of the clearinghouse, even though we've had states bowing out of participation in it, most recently Nevada, about how they expect once it really gets operating in a smooth manner that other states will come around to the notion of this sharing mechanism. I really, it's just one of those interesting things because it's just denial about the ability or the desire of any of the large states to reverse their positions on taking 100% of the surplus lines premium tax. Just incredible that we are continuing to see this kind of a fantasy that's ever going to become a viable national option. On the healthcare front, Councilor Sender of Steptoe, our general counsel, has pointed out from minutes after the Supreme Court decision the importance of the Medicaid donut hole that has been opened up. And we continue to believe that this is far more problematic to the Affordable Care Act, irrespective of the political outcomes of the election for the President and the Senate and the House this fall, than the press and then even legislators seem to be considering it. As you know, the Supreme Court overruled the portion of the Affordable Care Act that would have mandated that states pay up to 133% of the poverty line to finance that before anyone would be eligible for subsidies through the state-based exchanges or through the federal exchange, and that's a legal question mark as well. With that big hole that's been opened up, most all of the red states, led not surprisingly by Governor Perry of Texas, said absolutely they are not going to fund the Medicaid expansion there. And so I had a small dinner I was at this week with a member of the House Republican leadership, someone who is very, very bright, very knowledgeable in health insurance and health reform related issues. And I asked the question, what's this going to mean? And what he said was, well, this just means that Obamacare is going to cost a whole lot more than anybody ever intended for it to cost. But the reality is we don't know how you connect those dots short of a wipeout by President Obama with the Democrats maintaining control of the Senate and retaking control of the House. And I don't know many people that expect that that's going to be the case. A lot's going to change between now and then. But how legislatively they'll be able to overcome this. You can't, by executive order, you can't finagle away for the federal government to pay that gap. And so irrespective, as I said, of the election results, this is going to be very, very interesting to see how it all plays out. So we'll be keeping an eye on that. Hope you're doing well. Hope you're staying cool. Talk to you soon. Thanks.